Hello everyone and welcome to the part 1 of most anticipated MCQ series for NEET PG 2024. A series which is specially designed for all the students who are appearing for NEET PG 2024, keeping in mind those topics of forensic medicine which are repeatedly asked in the examination, right? So if we are well rehearsed with these topics, the chances of marking every question correctly is very high, right? To fulfill this objective, I'm coming up with most anticipated MCQ series right before the examination time, so that all those students who see this video, उनके दिमाग में ये फोरेंसिक मेडिसिन के क्वेश्चन एकदम तरोताज़ा रहेंगे। पार्ट 1 आज आप देख रहे हो। पार्ट 2 will be released on 11th of June and part 3 will be on 18th of June, right? तीनों parts में the questions and the matter that we discuss are the questions and the matters of forensic medicine, the concepts of forensic medicine which are repeatedly asked in the examination. So let's take up our first question for discussion. The first question says, uh, A kills B with a knife, B dies on the spot. Person X sees this and reports to police. Upon inquest, the dead body is autopsied by Dr. Y. If both an X and Y come to the court to give statements, that is, as witnesses, which statement is true regarding witnessing during the court trial? The four statements are: option A, statement of X will be indirect oral evidence. Statement of Y only will be of an expert witness. Both X and Y statements will be considered as documentary evidences, and D, statements of both X and Y will be expert witnessing. Right? To answer this question, first of all, uh, let's understand the two aspects which are asked in the question here. One is regarding the evidence, and second is regarding the witnesses. So let's study what are different category of evidences or witnesses, right? So we can see that evidences are basically of three type. One, oral evidence, which can be further divided into direct, indirect and hearsay, right? वो क्या होते हैं वो हम अपनी टीचिंग में जानते हैं. Second is documentary evidence, anything which is submitted as a document in the court of law, for which there is no person coming to the court of law and orating the authenticity or the content of the document, right? If such person is not coming to the court of law, only the document is accepted. That's called as documentary evidence. And third is hearsay. And then witnesses are of two qualities. One is simple witness and second is expert witness. So who are expert witness? Expert witnesses are people having expertise or experience in their field of work. So when they come to give evidence in the court of law, they have a privilege over the simple witness, and that privilege is that these expert witnesses, they can give opinion regarding their work or whatever findings they have gotten in their work. They can give opinion. Simple witnesses cannot give opinion. Simple witnesses cannot give opinion. Okay, so these are different categories of witnessing and evidences. Now अगर हम इस नॉलेज के साथ में अपने क्वेश्चन पे वापस जाते हैं तो हमें क्या दिखाई देता है? यहाँ पर क्वेश्चन में दो विटनेसेस है. वन इज एक्स, द सेकंड इज वाई. X is a person who has actually seen the incident happening. Y is the person who has conducted post-mortem on the victim, which means X is a simple witness, but because X has seen the incident happening in front of his eyes, he becomes a direct witness. Which means when X will be giving evidence in the court of law, it will be recorded as evidence given as direct evidence, right? So his quality of evidence will be oral direct evidence, which means statement A, which says statement of X will be indirect oral evidence, it's a wrong statement, right? Now, if you look at Y is an expert witness because he has conducted the post-mortem on the dead body, and the person who is conducting that post-mortem is expert in conducting post-mortem, so his witnessing will be considered as a witnessing coming from an expert witness. Okay, and when he will go to the court of law and he will speak whatever findings he saw in the dead body, his opinion will be counted. If you read statement B, which says statement of Y only will be of an expert witness, it seems to be a correct statement. Now, if you see statement C, both X and Y will be documentary evidences. This is a wrong statement because when both X and Y are coming to the court and giving evidence, it means both of them are giving oral testimony, right? And statement D, which says statement of both X and Y will be of expert witnessing, it will again be a wrong statement because we have already seen in our description earlier that X is a simple witness, whereas only Y is an expert witness. So, correct statement is statement B, indicating that only Y will be considered as expert witness in the court of law, right? Uh, with that, let's move to understanding of yet very important aspect in this uh, chapter, and that understanding involves understanding of the recording of evidence, understanding of recording of evidence. Okay, so when a witness comes to the court of law, इस जगह से भी बहुत क्वेश्चन आते हैं, क्या सीक्वेंस रहती है उसकी एविडेंस के रिकॉर्डिंग की, कौन करता है वो एविडेंस रिकॉर्ड, और डिफरेंट डिफरेंट स्टेजेस ऑफ रिकॉर्डिंग ऑफ एविडेंसेस में क्या क्या इंपॉर्टेंट प्रोविजंस होते हैं, राइट? For the sake of understanding, we will presume that the witness which has come for the recording of evidence, that witness is a prosecution witness, also called as PW, right? So the first thing that happens with the prosecution witness is examination in chief, also called as direct examination. That examination is conducted by prosecution lawyer, and there is one very important limitation of this examination. That limitation is leading questions are not allowed. Leading questions are not allowed. Once the examination in chief finishes, then this prosecution witness will be available to the lawyer of the opposite side, and that examination is called as cross examination. So next चीज जो होगी वो होगी cross examination, which is conducted by defense lawyer, right? Lawyer of the opposite side. And one important provision which is available in cross examination is leading questions are allowed. Leading questions are allowed, right? After cross examination finishes, if required, the witness may have to undergo what is called as redirect examination or re-examination in chief. That is only if required. Okay, again it is conducted by prosecution lawyer, and again as there is prosecution lawyer and prosecution witness are talking together, as we saw earlier in examination in chief that leading questions were not allowed, in redirect examination also leading questions are not allowed. Leading questions are not allowed. Okay, so this aspect of when leading questions are permitted in the court of law, it has been asked multiple times in NEET PG examination. Okay, so remember, leading questions are allowed during cross examination. Okay, let's take the next question. Next question is, a doctor has to perform autopsy in a case of death due to head injury. So in this question, we can clearly see the cause of death is given as a suspected head injury. Which cavity should be opened last? Not the first. आखिरी में कौन सी खोलेंगे? The choices are abdomen, thorax, head, or neck. So one thing is clear after reading everything that we know about autopsy, that in routine autopsy cases, the four body cavities which are opened mandatorily, वो कौन सी होती हैं? Their head, neck, thorax, and abdomen, right? So if we want to talk a little more about what cavity should be opened first or what cavity should be opened last, uh, one should know some basic thumb rules. Some basic thumb rules. So basic rules of opening body cavities during autopsy. So what are the basic rules? Remember, first thing, open the cavity first having the cause of death. So the basic rule is, जहां पर आपको cause of death suspect लग रहा है, उस कैविटी को पहले खोल लो. बट इसमें ना दो बहुत ही इंपॉर्टेंट एक्सेप्शंस हैं. ठीक है, एक्सेप्शंस क्या है? नेक and head. So if you suspect the cause of death to be in neck, that is in compression of neck, hanging के cases में, strangulations के cases में, or the cause of death to be in head in cases of head injuries, what we want is, when we open these spaces, we want a relatively bloodless field. Okay, what do we want here? Relatively bloodless fields, and that is why, although the cause of death may be in neck or head, because we want relatively bloodless field, हमें head और neck के cases में head और neck last में खोलना चाहिए, right? तो जहां पर neck में है cause of death या जहां पर head में है cause of death, ट्राई कीजिए कि उसको लास्ट में खोलिए. सो बेसिक थंब रूल के हिसाब से क्वेश्चन तो हमने यही सॉल्व कर लिया, बिकॉज इन दिस क्वेश्चन वी आर टॉकिंग अबाउट अ केस ऑफ हेड इंजरी, and in cases of head injury one should open head as the last cavity. So correct answer here is head itself. Okay, but what if we encounter a dead body जहां पर हमें आउटर इंस्पेक्शन पे नहीं पता चल रहा, where could be the cause of death? It could be a situation of poisoning, it could be a situation of air embolism, it could be a situation of sudden cardiac death, it could be a situation of any fat embolism, and there are multiple other pathological causes where we do not get anything in the gross outer inspection of the body. In such cases, when we do not know where is the cause of death, which cavity should be opened first. So remember, when the cause of death is not apparent on outer inspection of dead body, right? What body cavity should be opened first? In this case, we should try and open the head first. ओके, तो ये दो बहुत सिंपल से थंब रूल हमें याद रखने हैं जहां पर हमें कॉज ऑफ डेथ आउटर इंस्पेक्शन पे मिल रहा है, यानी कि अगर आपको ऐसा लग रहा है कि द पर्सन हैज बीन हिट stabbed multiple times in the abdomen, or the person may have been stabbed on the chest, so cause of death could be in abdomen or chest. Open the abdomen or chest first. Wherever you think the cause of death could be found, open those cavity first. एक्सेप्शन नेक एंड हेड. अगर आपको मालूम है कि नेक में कॉज ऑफ डेथ होगा या फिर हेड में कॉज ऑफ डेथ होगा, ट्राई एंड ओपन नेक एंड हेड लास्ट, बिकॉज हमें यहाँ पर रिलेटिवली ब्लडलेस फील्ड चाहिए होगी. ओके, और जब हमें कॉज ऑफ डेथ नहीं पता होगा, यानी कि आउटर एक्सपेक्शन पे हमें पता ही नहीं चल रहा कॉज ऑफ डेथ कहाँ हो सकता है, देन द थंब रूल सेज ओपन द हेड फर्स्ट. Okay, so remember these important aspects about opening of body cavity or sequence of opening of body cavity. ठीक है, इसी के साथ में आइए एक और चीज देखते हैं, and that is preservation of viscera. So when we say that autopsies are done and the viscera needs to be preserved, एग्जैक्टली हम विसरा के प्रिजर्वेशन में क्या क्या प्रिजर्व करते हैं और कैसे कैसे करते हैं. So we preserve the body contents in 4 separate jars or bottles. In jar number 1, we preserve stomach and small intestine, right? In bottle number 2, we preserve blood, okay? In bottle number 3 or jar number 3, we preserve longitudinal half of each kidney plus complete spleen plus portion of liver containing gall bladder, right? And in bottle number 4, we preserve urine. We preserve urine in bottle number 4. So जब हम कहते हैं कि विसरा प्रिजर्व करना है, these are the things that are preserved, nothing else. Okay? और इनमें क्या क्या प्रिजर्वेटिव ऐड करते हैं? So preservatives which are added to these content is, in jar number 1 we add saturated solution of common salt, right? In bottle number 2, that is blood, we add sodium fluoride. Okay, we add sodium fluoride. In jar number 3, again we add saturated solution of common salt. Okay, and in bottle number 4, that is urine, there are few preservatives which can be used to preserve urine. It could be hydrochloric acid, or we can add sodium fluoride, we can add thymol, which is the most advocated one, thymol, or we can use toluene. Okay, so these are certain preservatives which can be used for preservation of urine. So when we talk about preservation of viscera, again an important area, when we read about autopsy procedures, remember these important concepts. Okay, now let's take up our the next question. The next question is: a female of age 38 years, mother of two children, is to be operated for gallbladder removal. The surgeon should obtain which type of consent for the operation? And then we have four consents which are given in the choices. The first is oral consent. The second is blanket consent. The third is informed consent. And the fourth is implied consent. Okay. So before we answer the question, okay, let's understand all these four forms of consent. The first we are going to answer is something called as implied consent, given in option D. So if you'll see, what is an implied consent? When situation implies that the consent is available and no one talks about it. For example, if I want to get my KFT done, I'll go to a pathology center, I'll pay the bill, whatever is the requirement, and probably go to the phlebotomist and extend my arm. My extending of arm implies that my consent is there for drawing of blood. The person who is going to draw the blood, he never explains the procedure for me, he just conducts the procedure. That's an example of implied consent. Okay. Second is informed consent. What is an informed consent? Giving oral information about the pros and cons of the procedure and taking written consent thereafter from the patient. So you tell the patient all the pros and cons that are associated with the procedure that you're going to perform on the patient, or any process that you need to do with the patient, or any kind of medication. Let the patient decide after the information that you have given whether he wants to choose your procedure or not, and if he wants to go ahead with your proposal, take a written consent from the patient. That's called as an informed consent. Blanket consent, uh, it is actually a condemned form of consent. It should not be practiced. What is blanket consent? Taking consent of many things hidden under a single proposal. Like you want to operate a patient uh, because he has some pathology in the abdomen, and you take the operative consent, and within the operative consent you presume that the patient would be comfortable in spinal anesthesia, so you do not tell the patient that it will be done in spinal. You just take the spinal consent alongside without telling the patient. Now that's kind of putting a blanket, to hide the anesthetic procedure. These kind of things are called as blanket consent, जहाँ पर डॉक्टर प्रिज्यूम कर रहा है कि पेशेंट ऑपरेटिव कंसेंट दे ही रहा है, तो स्पाइनल कंसेंट तो दे ही देगा क्योंकि ऑपरेशन स्पाइनल के बिना नहीं होगा. Now that is patient's choice. If the patient doesn't want to give spinal consent because the patient you know doesn't want anything to go in his spine, the patient may be ready for a short GA rather than a spinal consent. That's the patient's choice. So if you take a consent hidden under um some kind of a umbrella or blanket, that's called as blanket consent, should be condemned. And fourth is oral consent. Oral consent means when you take the consent orally, generally preferred for any small investigative procedures, like you want to auscultate someone. So just ask the someone to open up and expose his chest so that you can auscultate. That's oral consenting example. Now, if you read the question correctly, the female who is 38 years who needs to be operated for gallbladder removal, right? What kind of consent do you think will be most appropriate in this scenario? ये similar kind of question पिछले साल भी नीट पीजी एग्जामिनेशन में आया था, because this form of consenting is very very important, and that is informed consent. Correct answer here is informed consent. Remember, medico legal practice, any surgical procedure, informed consent is the best form of consenting. Okay, best form of consenting. Now, when we talk about consent, it's important that we understand what are different form of consent. Although मैंने सबकी description आपको पहले ही बता दी है, but remember, in practice, consent basically can be of two types. One, when the situation is implied that the consent is there, and second is जब सिचुएशन इम्प्लाई नहीं करती और कंसेंट को एक्सप्रेस करना पड़ता है. दैट्स कॉल्ड एज एक्सप्रेस कंसेंट. Express consent can further be of two types. It could be oral, it could be written, right? और हमने एग्जाम्पल में पहले ही देख लिया है informed consent, which is a very important kind of consent medico legally. It is a combination of oral and written consent, right? Oral explanation, written consenting. So remember, informed consenting consists of both oral and written component. ओके, तो कंसेंट के बारे में ये चीज हम याद रखेंगे, एग्जामिनेशन के पॉइंट ऑफ व्यू से बहुत इंपॉर्टेंट है. लेट्स टेक अप द नेक्स्ट क्वेश्चन. So the next question is, from a site of burnt building, a pelvis is recovered. What will tell the investigator that it is a female pelvis? So, very direct question, simply asking what are the features of female pelvis versus a male pelvis. Okay, let's read the options. The options are presence of prominent pre-auricular sulcus, small acetabulum, U-shaped subpubic angle, small triangular obturator foramen, and then one more option is there, all of them. Now, when we talk about uh, difference between male and female bones in general, remember two very basic fundamental things. One is male bones are generally bigger. Second, male bones are generally heavier and more coarse as compared to female bones. Okay, these are two very basic thumb rules. Now let's see what are some important features which are present in a female pelvis. So if you see option number A, that is uh, presence of prominent pre-auricular sulcus. Yes, this is seen in female pelvises. Pre-auricular sulcus is basically an indentation groove created at the inlet of the pelvis because of the sacroiliac ligaments. Okay, very common feature of a female pelvis, very uncommonly found in male pelvis. Second is small acetabulum. The answer again is yes, as we have already seen that one basic fundamental rule is male bones are generally bigger. So female bones tends to be smaller. Even the features of the female bone generally tends to be smaller as compared to features of the male bone. Third is U-shaped pubic angle. Now this is one exception where some part of the female bone is bigger than the male bone. Why? Because in female the pelvic outlet is bigger. As a reason, the female tends to have a U-shaped pubic angle, whereas in males we have V-shaped pubic angle, or you can say more acute pubic angle. Okay, then fourth option is small triangular obturator foramen. Again the answer would be yes, because as I earlier said, male bones are comparatively bigger, female bones are smaller. Male tend to have large and oval shaped obturator foramen, right? So correct answer in this situation would be option E, all of them. Now this is one question or a kind of question which very often comes in NEET PG examination. Okay, features of male or female pelvis or features of male and female skull, right? To answer any of these kind of questions, remember two very basic fundamental rules. Male bones are generally bigger, female bones are comparatively smaller, and male bones are generally heavier and more coarse. Okay. Now moving on, let's observe some differences present between male and female skull. Okay. So these are some important differences to remember. When we talk about forehead, male bone or male skull is steeper, so it is less rounded. Female bone is more rounded, and because female forehead is more rounded, the frontal eminence in female tends to be large. Now, this is one exception which you should remember, that there is something which is larger in a female bone as compared to male bone. What is that? Frontal eminence, right? If you look at all other uh, options or possibilities, glabella more prominent in male, less prominent or smooth in females, orbits square in shape and lower setting on the face, whereas in females it is rounded and their setting is higher on the face. Okay. Then supraorbital ridges, they are more prominent in males, less prominent in females. Okay. Then zygomatic arch, as you can see, it is more prominent in males, right? And it is less prominent in females. Okay. And mastoids are wider, longer, or you can say heavier in males, and they are narrow and short in females. Again, what do we see? Something which is narrow, short, lighter, it goes in favor of female skull bone feature. The only exception is frontal eminence, which is large in females. Okay. A forceful sexual intercourse is reported by a female which happened in a hotel room. So she is victim of a forceful sexual intercourse. Team of investigators inspect the area and attempt to find any seminal spots on the bed, right? So they are looking for any seminal droppings which they can find as evidence in that crime scene. What would help them discover the seminal spots at the crime scene? The options are infrared light, UV light, natural sunlight, or luminol spray on the area. So there are four options. The question is basically asking that if you suspect seminal droppings on a certain area, it could be clothing, it could be bed linen, it could be any other space, because once the semen drops and stays there for a while, it's going to dry up. Okay, after a while, and it will become difficult to find dried seminal stains, particularly if they are old also, at crime site on certain kind of linens or beds, right? तो हमें किस तरीके की मदद चाहिए? The answer is option B, that is UV light. And why UV light? Because semen has luminescence or glow. Okay, semen has luminescence or glow in UV light. So all we need to do is to light the area with ultraviolet rays, and wherever seminal droppings will be, they will start to glow, and thus we can detect where the sample is. Option number 4, which is luminol spray on the area. This is helpful in this is helpful in detection of blood stain. It is helpful in detection of blood stain, right? So this is comparatively a simpler question, but yes, question from this aspect of forensic medicine, that is from trace evidences, is very commonly asked in the exam. To have a better understanding of these two very important trace evidences, out of which the first one is semen, right? Let's see what do we need to know about semen. First is detection of semen. So this is something that we have already seen, that detection of semen is done by UV light. This is, we've already seen detection of semen is done by UV light. But how would you preserve that sample? So if you have detected semen or seminal stain or dried seminal stain on some kind of bed linen, now how are we going to preserve it? Cut the cloth from the edges of the stain, cut the cloth, preserve in an envelope. सिंपल, काटना है और एनवेलप में डाल के फोरेंसिक साइंस लैब भेज देना है फॉर फर्दर एग्जामिनेशन एंड कंफर्मेशन ऑफ सेमिनल सैंपल। इन फोरेंसिक साइंस लैब आइडेंटिफिकेशन किस तरीके से की जाती है? रिमेंबर 3 वेरी इंपॉर्टेंट थिंग्स अबाउट सीमन। द फर्स्ट वन इज absolute proof of semen. What is absolute proof of semen? Stain the smear made from सैंपल। तो जो सैंपल आया है उससे स्मीयर बनाना है और उसको स्टेन करना है सिंपली किस पे? जो हमें ग्लास स्लाइड मिलेगी माइक्रोस्कोपिक एग्जामिनेशन, ठीक है? और इसका हमें माइक्रोस्कोपिक एग्जामिनेशन करना है। एंड व्हाट शुड वी फाइंड इन दैट स्टेन स्मीयर? एट लीस्ट one intact spermatozoa. So if we are able to find even one, but at least one intact spermatozoa, not broken, it is taken as absolute proof of semen. Absolute proof मतलब इसके बाद हमें कोई और एग्जामिनेशन नहीं करना, ठीक है? इसके सिवाय हमें दूसरा बड़ा इंपॉर्टेंट सीमन के साथ टेस्ट याद रखना है, वो क्या है? हाई एल्कलाइन phosphatase. Semen has high alkaline phosphatase, right? If alkaline phosphatase is more than 100 Bodansky units, it is taken as a seminal sample. Okay. तीसरी चीज जो हमें याद रखनी है, 2 इंपॉर्टेंट माइक्रो क्रिस्टल टेस्ट जो सीमन के साथ होते हैं। माइक्रो क्रिस्टल टेस्ट, माइक्रोक्रिस्टल टेस्ट मतलब क्या होता है, स्मीयर बनाना है सैंपल का, एंड देन वी नीड टू स्टेन दैट स्मीयर विद सर्टेन केमिकल्स, एंड देन वॉच द स्मीयर अंडर माइक्रोस्कोप एंड सी if they generate some specific kind of crystals. Okay, so one microcrystal test is called as the Florence test. फ्लोरेंस टेस्ट में हमें कौन से क्रिस्टल्स मिलते हैं, वी गेट क्रिस्टल्स ऑफ choline iodide, we get crystals of choline iodide. And the second test is Barberio's test, जिसको हम बोलते हैं पिक्रिक एसिड टेस्ट, ऑल्सो नोन एज पिक्रिक एसिड टेस्ट. इसमें हमें कौन से क्रिस्टल्स मिलते हैं, वी गेट क्रिस्टल्स ऑफ स्पर्मीन पिक्रेट, we get crystals of spermine picrate. ओके, तो ये दो क्रिस्टल्स याद रखने हैं हमें सीमन के साथ में. मूविंग ऑन टू लुक फॉर what are the important things to remember about blood. Okay, again the first thing is detection of blood, how to detect blood samples in the crime scene. क्वेश्चन के साथ भी हमने देखा था ब्लड सैंपल को डिटेक्ट करने के लिए क्या करना होता है, ल्यूमिनल स्प्रे, right, luminol spray. When you spray luminol substance on an area which is containing blood or a dried blood sample, the dried sample starts to glow, emit blue and white light, so that could be a blood sample. तो वहां से हम कलेक्शन कर सकते हैं. फिर हम प्रिजर्वेशन कैसे करेंगे, if it is a dried sample, right, scrape द सैंपल, जमीन पे है तो स्क्रैप करके उस सैंपल को उठा लो एंड पुट इन एनवलप, सिंपल, स्क्रैप द सैंपल एंड पुट इट इन द एनवलप. अगर वेट सैंपल है तो अगर वेट ब्लड है या बॉडी में से आप ब्लड प्रिजर्व करना चाहते हैं एट द टाइम ऑफ ऑटोप्सी, यहाँ पर लिक्विड फॉर्म में है ब्लड, वहां कैसे करते हैं, soak a gauze with blood. Okay, let it dry in normal air, जो भी नॉर्मल एयर है, कोई हीटेड एयर नहीं, कोई कूल्ड एयर नहीं, नॉर्मल एयर में उसे ड्राई होने दो जिस तरह से कपड़े सूखते हैं, दैट्स ऑल. देन पुट द dried cloth in an envelope. इस सिंपल तरीके से हम प्रिजर्वेशन कर सकते हैं सैंपल का. हाउ अबाउट आइडेंटिफिकेशन ऑफ ब्लड, अगेन रिमेंबर 3 वेरी इंपॉर्टेंट टेस्ट फॉर आइडेंटिफाइंग blood in forensic science lab. The first two are microcrystal tests. First one is Teichmann's test, which generates crystal of hemin chloride, right. Number 2, Takayama test, which generates crystals of hemochromogen. Hemochromogen. Okay, but the most specific test for blood is most specific, or we can say most confirmatory test for blood is spectroscopic analysis of the alleged blood stain. Okay, so these are important things that we need to remember about detection, uh, uh, preservation, and identification of two very important uh, biological stain, semen and blood. Let's take the next question. Next question is, a dead born fetus will have all the signs except, okay, the options are macerated body, overriding of skull bones, diaphragm dome at 4th to 5th intercostal space, and last option is air filled middle ear cavity. So, if you have read the chapter of infanticide correctly, we understand that a dead born fetus has a macerated appearance. So, the first option is correct, right? Overriding of skull bones again is a feature which is seen in a dead born fetus. This sign is called as Spalding sign. The sign is called as Spalding sign. So even this is seen in a dead born fetus. And third is diaphragm dome. Now in dead born fetus, the lungs haven't respired, right? So the dome of diaphragm is higher up, and that space is 4th to 5th intercostal space only. When the lungs respire, they push the diaphragm down. They push the diaphragm down. And now, after respiration, that is live birth, the dome of the diaphragm, they are in 6th to 7th intercostal space. So, if you find that dome of diaphragm are in 4th or 5th intercostal space, this again is seen in a dead born fetus. So all the first three options are absolutely correct, which means if we rule the correct options out, the only wrong option is option D, that is air filled middle ear cavity. Now, this air filled middle ear cavity is seen in live birth. Okay, this test is called as Redin's test. Redin's test. Redin's test says that in a dead birth, right, the middle ear is filled with gelatinous fluid, right? But in live birth, as the child is born alive and he respires, not only he respires, but the atmospheric pressure starts to act through his eardrums. This gelatinous fluid is pushed into the draining nasal concus, and now the middle ear is filled with Air. So if the middle ear cavity is filled with air, it is a live birth. If it is filled with a gelatinous fluid, it is a dead born fetus. This is Redin's test. Okay. So apart from these tests and some specific findings, इस चैप्टर में से एक और बड़ा इंपॉर्टेंट एरिया है और वो क्या है, हाउ टू डिस्टिंग्विश बिटवीन रेस्पायर्ड एंड नॉन रेस्पायर्ड लंग. ओके, तो ये 5 बड़े इंपॉर्टेंट फीचर्स हैं दैट वी नीड टू रिमेंबर. कलर, respired lung, that is a dead born fetus, color would be dull gray or brown. Okay, sorry, in the non respired lung, that is a dead birth, whereas in respired lung, which is a live born fetus, the color of the lung should be pink. Why? Because respiration के साथ में pulmonary circulation establish होता है और lung का color bright pink हो जाता है. Texture, we need to cut the lung, and as a control sample we take the liver. So if it cuts easily just like liver, it is a non-respired lung. If it resists cutting, that is it behaves like a sponge क्योंकि उसमें हवा भरी होती है, then it is respired lung. Borders, if the borders of the lung are straight, non-respired lung. With respiration, as the lung will inflate, the borders will become rounded. So roundening of borders means respired lung. Air cells. Air cells are hexagonal structures that you can feel on the surface of the lung. So you need to feel the surface of the lung with your palm. If it is a non-respired lung, that is dead birth, air cells will feel flat on the surface. If it is a respired lung, they will convex out, because when the lung is going to balloon up, the air cells will convex out. So you will be able to feel the convexity of those air cells. So convex air cells means respired lung. And fifth is weight of the lung, which is given by 2 tests. The first one is Fodor's test, which says non-respired lung weighs 30 to 40 grams, and with respiration the weight of these lungs get doubled up, so it becomes 60 to 66 grams. Okay, the same thing is said by the Fodor's test, but in a different fashion. Fodor's test says, same thing is said by the Blockwood's test, right? Fodor's test is 30 to 40 becoming 60 to 66, so doubling of the weight is seen. Blockwood's test says weight of non-respired lung is 1/70th of the total body weight, which again doubles up with respiration, so it becomes 1/35th of total body weight. Okay, so both the tests say the same thing. It's just that Blockwood's tests say the doubling of the weight of the lung in ratio to the total body weight, whereas Fodor's test says the same thing in direct measurements in grams. A ligature mark 1 centimeter broad is running all around in the middle of the neck of a dead body. So an important information is given in the first line of the question is itself that it is running all around. So there is no breakage in the ligature mark. It's not absent, it is present all over the circumference of the neck, and it is running in the middle of the neck, not in the upper half or in the lower 1/3. It is in the middle 1/3 of the neck. The hands are tied with a rope. Again, a very important information is given. The hands are tied with a rope. Upon dissection at autopsy, hemorrhagic patches are seen beneath the ligature mark. very important information again, that hemorrhagic patches are seen beneath the ligature mark. Okay, this is most consistent with. Okay, so let's see what are the informations that are given to us in the question. One, it is a ligature mark which is present all around the neck. It is present in the middle one third of the neck. The hands are tied. The dead body has tied hands, and hemorrhagic patches are seen beneath the ligature. Now, when we read this question, that the hands are tied, right? The first option seems to be ruled out from there. That is suicidal hanging. Okay, because the hands are tied, it means that there would be presence of any third party, right? So it should be a case of certain kind of homicide, right? It could be certain kind of accident also, and we have an option, that is option number D given in the choice, which is called as accidental strangulation. But again, in accidental strangulation, tied hands are not expected to be found, so even option D is ruled out, right? Why did I say that it could be an accidental strangulation? Why accidental strangulation could have been a probability? Because if you will read the findings that are given, that the ligature mark is all around the neck, it is in the middle one third of the neck, and hemorrhagic patches are present. These are consistent with strangulation rather than hanging. These are consistent with strangulation. Okay, but as the hands are tied, accidental strangulation is not a possibility. Suicidal hanging is not a possibility. Homicidal hanging, could that be a possibility? Yes, homicidal hanging, which is also called as lynching, it could be a possibility. And in homicidal hanging, we can still have tied hands, because lynching is done by a group or mob of people who may be, killing a culprit to give him some certain kind of punishment. So tied hands is a possibility in lynching. But then again, if it is a homicidal hanging, right, the expectancy of development of ligature mark is an oblique ligature mark in the upper one third of the neck, right? Because those are two very important features of hanging ligature: oblique ligature mark, upper one third of the neck. But what is the option given to us? That it is a complete ligature mark running all around the neck, and it is not in the upper one third of the neck, it is in the middle one third of the neck, which means homicidal hanging is also not a possibility. So what is remaining? The remaining is as simple as it is a case of ligature strangulation, and it is a homicidal situation, right? So just by elimination, जो हमें important informations मालूम है हैंगिंग और स्ट्रैंगुलेशन के बारे में, अगर आपको किसी एक के बारे में भी कंप्लीट इन्फॉर्मेशन मालूम है, जैसे कि मुझे हैंगिंग के बारे में मालूम है कि हैंगिंग का लाइगेचर मार्क अपर वन थर्ड ऑफ द नेक पे होता है, ओब्लिक होता है, इनकम्प्लीट होता है, नेक पे पूरी चारों तरफ दिखाई नहीं देता है, और जब उसको डिसेक्ट करते हैं तो अंदर हेमोरेजिक पैचेस नहीं मिलते हैं. Everything opposite happens in strangulation. The ligature mark is complete, it is horizontal, not oblique, it is expected to be seen in the middle one third of the neck. And when you dissect a ligature mark of a ligature strangulation, hemorrhagic patches are expected to be found under the dissection area, right? So ligature strangulation is the correct choice. इस तरीके के क्वेश्चन नीट पीजी के एग्जामिनेशन में बहुत ज़्यादा आते हैं. आइडेंटिफिकेशन ऑफ द काइंड ऑफ एस्फिक्सिया बेस्ड अपॉन द लाइगेचर मार्क और पैटर्न ऑफ लाइगेचर मार्क प्रेजेंट ऑन द नेक. कई बारी फोटोग्राफ्स भी दिखाई देती है. ओके, आइए इसी के साथ में एक छोटी सी डिस्कशन और करते हैं हम कि हम किस तरीके से ड्राउनिंग के केसेस में डिफरेंशिएशन कर सकते हैं, एंड दैट इज बिटवीन फ्रेश वाटर वर्सेस सॉल्ट वाटर ड्राउनिंग. फ्रेश वाटर वर्सेस सॉल्ट वाटर ड्राउनिंग में ये टेबल हमें याद रखना है. सोर्स, फ्रेश वाटर का सोर्स क्या होता है? river, lake, pond, domestic water, any kind of common water source जो हम बोलते हैं वो फ्रेश वाटर होता है. ओके. सॉल्ट वाटर ड्राउनिंग कहाँ होती है? वो होती है सी वाटर, समुद्र के पानी. ओके. ब्लड की पिक्चर कैसी होगी? फ्रेश वाटर में होगा हीमो डाइल्यूशन. सॉल्ट वाटर में क्या होगा? हीमो कॉन्सेंट्रेशन. तो फ्रेश वाटर में सर्कुलेशन कैसा होगा? ओवरलोडेड. हीमो डाइल्यूशन की वजह से ओवरलोडेड सर्कुलेशन होगा. ठीक है. पोटेशियम एंड सोडियम का क्या स्टेटस होगा? फ्रेश वाटर में होगा हाइपरकैलीमिया विद हाइपोनेट्रीमिया बिकॉज ऑफ हीमोडाइल्यूशन. ये कोरिलेटिव चीजें हैं, आप देख सकते हो. whereas in salt water, because there is hemo concentration, we are expecting hypernatremia. ओके. लंग्स की पिक्चर कैसी होंगी अगर डेथ होती है इन सिनारियोज में? इन फ्रेश वाटर ड्राउनिंग द लंग्स आर बिग, voluminous, maintaining their shape. The shape is retained, but they are big and voluminous, filled with water, of course. In saltwater drowning, the filling of water in lungs is more massive as compared to freshwater drowning. So massive swelling lungs की किसमें होगी? Salt water drowning में. And that is why the lungs are heavy and boggy, not able to retain their shape. They kind of become globular structures. Okay. तो ये कुछ important points अगर आप याद रख पाओगे एग्जाम से पहले, it may just help you in solving any of the question that might come either from freshwater drowning or saltwater drowning phenomena. Right? Great. So with that, we come to the end of discussion of these questions and associated phenomena with those questions. Right? I just hope and pray that it helps you in your forthcoming examination. I'll see you in part 2 with few more questions from different areas and topics of forensic medicine, which is going to be released on the same channel on 11th of June. Till then, bye bye और डट के अपनी तैयारी करते रहिए.